Good afternoon, everybody. Thank you so much for joining us for our HealthLinks webinar today. My name is Michelle Hahn, and I'm the Program Manager for HealthLinks. And our team really enjoys putting together these educational webinars for everybody and having you attend them so that we can provide you some more tools and resources to help you create healthy workplace environments. And today we are really excited to talk about a hot topic, family-friendly workplaces, and thinking about work-life integration. And I will be introducing our speaker in a few moments, but I just wanted to go over some housekeeping items for you all. As you log on, if you could keep yourselves on mute, that would be really great to prevent any feedback and problems with sound. If you have a question during the webinar, you can simply type it in the chat box, which should be in your control panel on the right-hand side of your screen, and we will save time at the end to address those. If there's something immediate, we'll flag it and pause the presentation, and our presenter will address that question as he's speaking today. Another note, we are recording this webinar, so if you find the information really valuable and want to share it with your colleagues, coworkers, friends, afterwards, we'll be sending out a follow-up email with a link to the recording and contact information so that you can contact our presenter if you need to or have any other questions. So be on the lookout for that email as well. So with that, I'm going to take a moment and introduce our speaker today. I'm really excited to be joined by David Shapiro. He is the Business Relations Manager at EPIC, which is Executives Partnering to Invest in Children. And I know he'll speak more about that organization as he introduces himself in the webinar. But David has been a really valuable partner over these past couple of years. We met him about a year and a half ago, and it has been a joy to work with him on talking about family-friendly workplaces and how you create policies and practices to support businesses in the community. And David is very much an inspiration. He is very passionate about what he does, and that leads him to be very successful and get a lot of things done. And it's amazing to watch their small team of 2 and all that they accomplish. We are very grateful for his partnership and really looking forward to having him present the work that we've been doing together and the work that he continues to do on a daily basis with you all today. So without further ado, I'm going to hand it over to David.
Thank you, Michelle, and thanks everybody for joining us on the webinar today. I want to say happy Read Across America Day to those of you that saw on our registration link. If you registered in our first 25 people and we decided to add the caveat if you're attending the webinar today, then you will receive a copy of Dr. Seuss's There's a Wocket in My Pocket. Today is Dr. Seuss's birthday, and I'm going to try and weave in a few inspirational questions or comments from Dr. Seuss where I can along this presentation. Such a beloved author for us, and really the theme of Read Across America is you're never too old, wacky, or wild to pick up a book and read with a child. So I encourage all of you at some point this afternoon, this evening, over the weekend, over the course of the month, to read with a child of any age, to read yourselves or with a partner, and it's important work to be done. Getting into our presentation, we're calling this work-life integration. And I just want to pause on the title screen because a lot of you have heard the term work-life balance before, and we're really trying to alter the terminology around this to be more using integration. When I think of balance, I think that of a scale, a picture of a lever and scale, and balance seems to imply to me that one thing is weighted more heavily than the other. And that's not where we want to go with family-friendly workplace policies and practices. We don't want the scale to be tipped necessarily in one way or the other for our conversation. So integration is really a better word for how we want to talk about the stresses of work life and specifically the reduction of work-life stress. Moving on, let me talk a little bit about EPIC. We are a membership-based organization of 75 or so executives, C-suite executives, started in 2010, and we section our work, or we compartmentalize our work to do advocacy, legislative work at the Capitol. We kind of have diminished in terms of some of our role there, and we have really ramped up in terms of our work in business engagement. We have a lot of partners that are employers and that have asked us for more resources on how to support employees in all stages of life, but specifically how to support employees with young children. And that has led us to the family-friendly conversation and our partnership with HealthLinks, Michelle and Lily and the team here at the School of Public Health. Why do our executives care about early childhood? There are multiple reasons. Oftentimes you'll hear folks talk about Dr. Jim Heckman, University of Chicago Nobel laureate, and the return on investment of investing in early childhood or young children. That there is a social return on investment argument for why we should all as a society invest in very young children, but there are some other reasons too that we're trying to point out, which is specifically that employers and businesses can benefit today based on supporting their current employees and current workforce. Workforce productivity, especially amongst those that have dependent care issues, if you're able to address those issues, workforce productivity and therefore the bottom line would be increased. And so that's the two-generation strategy we're approaching, which is supporting the workforce of today in addition to the workforce of tomorrow. And just a brief description of our organization. We are a partnership between top business leaders and experts from early childhood organizations, nonprofits, and foundations. And as I mentioned earlier, we're a membership-based organization, and we currently have 73 executive level members. I was speaking recently with a few folks about family-friendly workplace policies. And the image that comes up in everyone's mind is that of a pregnant mom leaving work or returning to work after having a newborn when we start to think about family-friendly workplace policies. And what I encourage everyone to do is think a little bit more broadly about family-friendly. It's not just about paid leave or maternity, paternity, parental care issues. It's a whole set of things. And the accompanying video, which hopefully will load up and play, is a brief description from one of our members about what Wells Fargo did to become a little bit more family friendly. Does it make sense if I try and play it, or have to try this? Okay. No.
We can move to
It's okay.
the website if you want. I don't know if it's loaded.
It's on the, it should be on the PowerPoint, but maybe not. No. Well, I'm happy to paraphrase what he said.
Okay.
Great, thank you. Well, we're going to pass on actually playing the video, but this will be a cue for me to talk to you a little bit about what Frank Newman at Wells Fargo Bank, the Western Region President, tells us that Wells Fargo did to become more family friendly. This is about 15 or 20 years ago. Wells Fargo realized that they weren't promoting specifically single moms as frequently as they'd like as bank tellers into more management and executive level positions. And they asked their staff why that was the case. And what they heard was banks at the time were opening between 7 and 7:30 a.m. Other branches maybe around 7:30 or 8. And as those of us who have children in public school know, trying to get them to school on time and get to work by like a 7 o'clock or earlier start time is pretty unreasonable. So what Wells Fargo decided to do was push the start time, the open time of their bank branches back by an hour in every location they could. And so now you'll see most branches open at 9. There may be some that open at 8 or 8:30, but that difference alone causes a huge boost in employee morale. And it's indicative of a culture shift of supporting employees in all stages of life, and definitely speaks to a bigger issue than simply something like paid family leave as part of family-friendly workplace policies. So that's the gist of what I wanted to talk about there for Wells Fargo and on that video. In our partnership with HealthLinks, and we will talk briefly at the end of this about some resources that are available to all of you, keep in mind the website, and we'll share this again, familyfriendlycolorado.com. That is where we will have Toolkit resources, and also we will have a link to our assessment that we've partnered with HealthLinks with to quickly analyze the family friendliness of your place of work. But when we started the process, almost 2 years ago, we convened an advisory team, some of you may be on the call today, of leaders in all sectors, public health, for-profit businesses, government, to populate the assessment that you'll see and be able to access at familyfriendlycolorado.com through HealthLinks. It's part of the HealthLinks certification templates or webinar web-based platform. And one thing we wanted to start off with is complicating what the word family means. So similar to what I just described, that when you think of the word family, oftentimes people go to an image of a mom, a dad, and 2 children as their go-to for the image in their head about family. That doesn't necessarily work in order to have equitable benefits for all employees. So as we travel around the state of Colorado, one of the experts we've talked to in this field, an academic in Pueblo, said, don't forget the childless single employees when you're talking about family-friendly workplace benefits. So acknowledging that the word family means a lot of different things to a lot of different people is a good place to start when looking at how your company, your business, supports employees in all stages of life. And you don't want to create a barrier from the get-go, which would be only addressing employees with young children or employees with families, traditional-looking families, as part of the family-friendly conversation. We want to broaden, we want to complicate the word family, as people have told us in focus groups and meetings in the past. I've heard my family is myself and my 3 plants at home. I've heard my family is myself and my brother and our 3 dogs. In my personal situation, my family is a blended family. And so what does that look like for employees? A lot of people are caring for elders and their parents or people of an older generation. So let's really be broad in terms of our discussion of what the word family means. As I mentioned, here's some other folks that can be included in your definition of family: elder care or aging adults, spouses or partners, pets, and whoever else you think might be appropriate. And once again, family-friendly organizations consider all employees. They consider employees in every stage of their life. There are several definitions in academic literature that we have quickly paraphrased and put into this presentation. The first one mentions the word balance. It's from 2013, and I think changing over to the word integration is probably a newer concept that we may be sort of ahead of the curve a little bit on. But one definition in academic literature says a family-friendly workplace is one that fosters and encourages work-life balance through professionally and personally shared goals. Another one identifies family workplaces as offering benefits and programs designed to support employees with balancing the conflicting demands of work, family, and personal time in today's complex environment. There's another reference to that word balance and potential conflicts or stress. Another from a little bit older talks about family-friendly workplaces as supports that decrease the conflict between work and family demands, leading to improved attitudes and behaviors of employees on the job and to improved ability to attract and retain qualified employees. I think we're starting on that one to get a little bit more towards the definition that we have come up with as a partnership, which is HealthLinks, EPIC, CDPHE, the Department of Public Health and Environment. And this is what we came up with after our advisory group convened over the course of 2016. A family-friendly workplace achieves a culture of well-being that supports individuals in all stages of life, to thrive and be productive at work, at home, and in the community. I think this is a very holistic definition, one that incorporates employees or individuals that have all sorts of different looking families. And it doesn't really talk about balance anywhere. It talks about thriving and productivity, which are key terms for the business community to hear. And it talks about a culture of well-being, not only at the workplace, but at home and at work. That's what we're trying to support and promote. Now, ultimately, as we discuss family-friendly workplace benefits, we are going to get to the question of why should my business or organization be more family-friendly? And to those of you on the call, I'm sure there are many of you that are what I would call early adopters or public health experts or public health advocates, or even early childhood advocates. The why family-friendly often comes very naturally and easy to you, and sometimes you may think, how come everyone else doesn't realize and understand how important this is? But we do still have to make the argument to decision makers at organizations, to executives. Maybe now would be a good time to infuse a Dr. Seuss quote. If Michelle can help me with my camera briefly. Y'all get to see me briefly for a moment, but we're gonna. I wonder if hopefully they'll see that. You think they're gonna see that backwards on their screen too?
Oh, yep.
Well, there's nothing I can do about that, but I will read it to you, which is that sometimes the questions are complicated and the answers are simple. So good luck reading that. We'll make the question. We'll make it in true Dr. Seuss fashion, even more challenging and difficult in that you're reading it backwards, which would be a Dr. Seussian way to look at things anyway. But sometimes the questions are complicated and the answers are simple. That really does relate to our conversation about family-friendly. As I had mentioned, many of you are thinking, gosh, this is a simple, I hear this all the time. Why isn't our business more family-friendly? Why doesn't my employer understand the importance of workplace flexibility, of paid parental leave policies, of paid vacation time, paid sick time, kind of the importance of having appropriate lactation rooms and breastfeeding support, the importance of understanding how expensive childcare is and the demands of those of us that send our children to early care, childcare and education settings, and how expensive that is. It speaks to me that the answer in all of our minds seems quite simple, and yet we keep coming across the fact that the answers are, or the questions themselves may be a little bit more complicated. And that's why we're giving you this list of why family-friendly benefits as a way. These are things that we've heard from employers across the state as pain points in their businesses and as ways to have the family-friendly conversation from a standpoint that may start to convince more people of why it's important. The first one I will put up there is potentially the most important one given the current employee statistics we're hearing from the state and how well our employment levels are right now, and that is attracting top talent. A comprehensive benefit package that addresses family-friendly workplace policies and practices is going to assist in attracting top talent, specifically in recruiting millennial and even perhaps drilling down more specifically to attracting millennial women into your organization. So if there is a need at HR, if they're talking about the talent race or attracting top talent, family-friendly benefits are actually a pretty cost-effective way to make the argument for attracting the right employees to your organization. And once they're attracted to the organization, the next thing that family-friendly helps with is diversifying the workforce. We heard specifically from Western Union, which is an employer in Douglas County with several thousand employees, that the reason why they increased their paid parental leave benefit in 2016 was specifically to attract and retain more women into the C-suite of their executive level management, to diversify management to include more women. This is an important one that may not come across your minds very often, but is very relevant to our conversation and our partnership with HealthLinks. The eligibility and recognition of getting things like the Best Places to Work Award, or what we hope to have, which is the EPIC HealthLinks Family Friendly Award for Colorado's most family friendly business. Being recognized as one of those businesses, as one of those employers, is actually quite important in the competitive marketplace of hiring new employees. So your eligibility on those awards is important. When you look at the literature from 10 or 15 years ago, you may see that retaining employees is the most frequently mentioned benefit for offering family-friendly workplace policies and practices. Kind of speaks to the idea of, in people's minds, a family-friendly may be the new mother returning to work or coming back from maternity or paternity leave. There's been some discussion recently in a few publications that seem to indicate that while retention is certainly a benefit and very important, we're trying to focus more on the attracting line, that first line item on this list, and talking about retention as a follow-up, but maybe not the first thing that comes out of our mouth in terms of family-friendly workplace policies and practices and their importance. And I'm happy to follow up with any of you if there's questions about why that might be. I think the general theme is the idea of leaving work to start a family or to have additional children, if we're looking at it in terms of dependent care of having a child, becomes a very personal decision. And while paid leave and the ability to return to work and the supports it presents are certainly part of this conversation, the individual family decision may trump whatever a company has to offer their employees. Therefore, talking about it more in terms of how you equitably offer attractable benefits may be a more salient example to give to executives. Increasing employee satisfaction and increasing employee happiness is clearly a reason why an organization should be more flexible or more family-friendly. This one speaks to the bottom line, which is reducing healthcare premiums. All of us have heard about, the exorbitant cost of healthcare, and I know that there are many partners, HealthLink partners, that talk about the opportunity to share their trainings and resources in order to reduce healthcare premiums. There may not be significant hard data right now to talk about how family-friendly workplace policies reduce healthcare premiums, but what we want to do is link it to mental health and wellness, overall stress reduction, and knowing that if we can reduce things like postpartum depression or anxiety and depression over caring for an elder, or anxiety and depression over child care related issues, that is going to have an impact on healthcare bottom lines. And all of these things speak to the last, which is improving the quality of work life. We've removed the word balance there, but you could probably change out that bullet point to say successfully integrating the demands, or successful work-life integration is where we want to lead all employers to. Just going to take a quick break here. Thank you. There are a few other items that came across as general global themes when we were having the work-life advisory team convene in 2016. And that is, we kind of have lumped this whole category into workplace policies and practices. However, there is a significant difference, especially in larger organizations, on written policies versus day-to-day practices. This is played out in organizations where there's a stratification, a significant stratification in income levels, that certain employees can access all benefits that may be offered by an employer or an organization, and employees that are either shift dependent or potentially in lower income ranges may not have access to the same practices as those that are in higher level executive management positions. So the difference and the lack of equity in written policies versus practices is something we want to address in our family-friendly conversation. I can't offer you a lot of insights into how to do this, but we can certainly start having the discussion about why it's important. We don't want the best intending of policies to fall apart in practice, and that's generally the theme of this slide and the theme of the conversation. We also don't want the best intending policies to be inequitable, to be only accessible by certain types of employees, because that is going to, similar to a previous slide, create resentment and disparity amongst employees, and that is not what we want to create in terms of successfully integrating the demands of work life. So what I implore you to do, in addition to complicating, so if you take away a few bullets from these first few slides, the first one is, how do you define family at your place of business? How are you going to complicate the word or the image of family? And the second one is going to be, how are you going to address equitable family-friendly workplace policies and practices? And the way you're going to do that is by looking at the current benefit package and doing an assessment of who benefits, who's able to actually take advantage of the policies as they're written. I would be remiss if I didn't talk a little bit, although I've been encouraged to remove the FMLA slide from this presentation, and we're not going to play the video that we have here. It is a good cue for me. I'm a big believer in promoting positivity and being an optimist in terms of talking about what we do have. And that's kind of what we're trying to do, pardon me, with the partnership with HealthLinks and the family-friendly assessment. We're trying to get a lot of case studies and best practices examples that we can share out broadly amongst employers in Colorado to talk and have a network of businesses that are supporting employees with young children or supporting employees in all stages of life, and to start to have some competition that if you want to be as cool as the employer next door, you'll want to offer some of these benefits at your place of business as well. So right now, the policy that's on the books federally is called FMLA. As some of you may know, the Federal Medical Leave Act, the Families in Medical Leave Act, pardon me, it is a federal policy. But I have this slide in here and a reference to Heather Boucher, who wrote a book called Finding Time, she's an economist, about FMLA or about the importance of paid leave, to talk about one piece of FMLA that is pretty well worded, actually, which is that FMLA is gender neutral, meaning that we have a policy federally in the United States where someone can take 12 weeks of dependent care, pardon me, unpaid dependent care leave, as long as they fit within the boundaries of FMLA, regardless of their, as long as the dependent care issue qualifies under FMLA, regardless of their gender. Two same-sex parents can take FMLA, a man and a woman can take FMLA, and they can take them concurrently with one another. So we do, in two-parent households or in two caregiver households, which we understand is not the case throughout the country, we do have an FMLA, an unpaid leave policy that is essentially 24 weeks that's okay for two parents or two caregivers to take consecutively. So I just want to highlight that, not that that's feasible for a majority of families out there. I do want to say that one interesting and good part of FMLA is in that it is gender neutral. That is, we're often compared to various Scandinavian countries and in terms of our poor performance when it comes to paid family leave. Many of them started with paid maternity leave programs and had to add a paternity leave piece later on in the process. So I will give credit to FMLA that it is gender neutral, and it's something to talk about as a good talking point for the benefit of FMLA. So in similar vein to complicating the word family, we also want to broaden the definition of family-friendly. I think I spoke about that earlier in terms of understanding our mental image when it comes to family-friendly workplace practices and policies. Workforce flexibility is clearly the #1 family-friendly benefit. However, what is usually talked about and sort of what the media talks about most frequently is paid leave. Paid leave is absolutely important as well, but flexibility and finding out where your organization can be more flexible may be an easier first step and first conversation than paid leave is. How does flexibility work? Flexibility is dependent on trust. Trust is essential in order to get the job done. Trust, especially between managers and employees, has consistently been identified as the most important way to carry out flexibility and have it be successful in the workplace. The emphasis in flexibility, or the emphasis for the trust, is on results, not necessarily face time and sitting at a desk. And the third bullet point that I would have you consider, so the first one was just to remind everyone, complicating the word family and how your place of business defines the word family. The second one was, gosh, I'm going to blank out on what the second one was. Do you remember what my second bullet point was that everybody needs to remember?
Just a minute ago.
Yeah.
No.
Okay. Well, we'll come back to what the second one was. So it's complicating the word family. And another important bullet point for everyone to remember is looking at where and how your workplace can become more flexible. I just remembered the second bullet point, which is who benefits from your workplace policies and practices. So it's complicating the word family. It's addressing equity in terms of who benefits from policies and practices. And this third one is important as well, which is identifying how and where your workplace can become more flexible. There could be small changes that people make that'll have a big impact on the lives of families, employees, and their children. My contact information is here. We do have all sorts of sort of bullet points and case studies that we can point to address this if you need more relevant examples to go to your executive management team. One thing that might be interesting to hear from those of you on the phone, if you're willing to type in as we're answering questions, is before you write a question or as you write a question, if you could give us your title at your organization. What we're trying to find out is, do those of you who are listening to this webinar, do you feel as though you can make a change at your organization? And if you can or cannot, what change can you make, or what recommendation can you make? And if you're not able to make a change in your organization, or if you don't feel like you're in a position to do that, who do you need to reach out to in order to do so? So we're happy to answer any questions you have. I do want to talk briefly before the question, so think about questions in your mind if you have any for us as I'm talking a little bit about the resource we're going to share with you. But what we'd like to hear is your title, and also, are you able to make a change at your organization? If you are, what do you think you can do, or how can we help you? And if you're not, who do you need to talk to in order to do that? The next Dr. Seuss quote in our, I'm not going to do the camera, so that's okay, but and maybe we'll post these later for everyone. I pulled them all offline, but another one I like, so the first quote was, "Sometimes the questions are complicated and the answers are simple." The next one I'll read to you is a very simple and short one, which is, "Everything stinks till it's finished." And there is a long road ahead of us when it comes to promoting family-friendly workplace policies. I'm not sure that we'll ever be finished, but there is a lot of muck that we need to go through in order to get to some of the outcomes that we all hope for. So the next quote on our Dr. Seuss Read Across America journey for today is, "Everything stinks till it's finished." And before we address any questions, if we do have any, I want to talk a little bit about the resources that we have available at familyfriendlycolorado.com. There are 3 buttons on that website when you go there. There's a link to an online employer toolkit that EPIC produced in 2011, maybe a little bit more appropriate for executive level folks. The resources shared on EPIC's online employer toolkit are probably meant for doing some calculations on terms of tax benefits and tax savings. The middle button is the one we really want everyone to focus on when you go to FamilyFriendlyColorado.com, which is our assessment tool that is soft launching right now. So many of you, as I've said, may have heard about this, and we'll certainly send the follow-up information. We're trying to get as many employers as possible to go through the process of signing up with HealthLinks and filling out the family-friendly assessment. The acronym, or the abbreviation we're going to use, is FF+. And so we want as many employers as possible to get an FF+ certification or an FF+ recognition, in the hopes that we'll get a really large pool of applicants and be able to give an award in November for Colorado's most family-friendly business. Maybe even several awards, and maybe we grow the award process over time to include various categories. The third resource that's up on FamilyFriendlyColorado.com is a toolkit, the Family Friendly Workplace Toolkit. I've heard from many of you that public health just loves to publish and produce toolkits. So here's another one for you. This one is all focused on the benefits of family-friendly workplaces. We are going to produce a one-page executive summary, and we are going to build individual case studies off of this toolkit. But right now, it's a public health-facing document about how to get started and some things you want to talk about. It goes nicely as a resource guide along with the assessment. If you wanted to have it beside you while someone was filling out the assessment, or if you want to talk to a business about what they can do to be more family friendly, what we're hoping to give you is multiple resources. One being, here's a toolkit that you can use, and another one being, here's a link to an assessment that you can use as well.
All right, you ready for some questions?
If there are any, sure, happy to answer some.
Yes. So Christy is a firm administrator. She said yes, she can influence changes, and they provide a lot of flexibility, so she's not sure what other changes she would present at this time. Okay,
great. Well, it's terrific that you're presenting flexibility as something that you can do. Have you looked at the cost and demands of childcare for your employees, would be my response to you in that. Perhaps you're already offering an emergency care plan. A lot of employers in Colorado offer like a 10-day backup care or emergency care situation. And what that looks like, for those of you that haven't heard of emergency care, is, let's say my child ended up sick this morning and I have a very important webinar that I'm conducting. Some employers in Colorado have a contract relationship with, there's a couple providers that we can link to or tell you about, where in that scenario, you call a 1-800 number and you get a child care provider that's on call to be able to come to your house that day so that you can go to work and host your very important webinar or attend your very important meeting. The companies that do that obviously do so for a fee, but it's nominal compared to the amount of work that could be lost if someone has to deal with emergency child care, backup care situations. And you know, is a pretty important way that businesses are supporting employees with young children. So look at an emergency backup care situation is one thing I would suggest. Another employer offers a policy that actually it's Boulder County. They released a written policy of it's okay to bring infants to work at any point, pretty much for any reason. And so you may have flexibility in terms of telework or off hours in terms of working core hours, but other times during the day being able to supplement those core hours. Do you have a written policy that it's okay for employees to bring their child to work when school is closed unexpectedly for a snow day? Or could you look at a backup dependent care, emergency care, child care provider as another benefit? There is a cost involved with that one, so you'd have to look at that from a bottom line standpoint. But those would be two recommendations I could give you. I guess a third one would be, what does lactation support and breastfeeding support look like at your place of business? As a male, I'm not privy to understanding exactly what breastfeeding rooms usually look like, but I have had conversations with a lot of you, including Michelle, about sort of the lack of quality lactation supports There are also providers on the secondary market or other providers that have programs where they help employees with the storage and shipment of breast milk if they have to travel for work while they're nursing. So there's another provider that we can address or talk to or send you to find out more information about that. So those are some of the things we've heard from other Colorado employers that want to do more or are doing more, and are looking at other solutions that are not just paid time off, which is a benefit that's important, but in addition to flexibility, you could look at emergency care, backup care. You could look at lactation supports, and you could look at having a written infant at work policy. Those would be three suggestions I have, and I'm happy to talk to you more about those.
Deb, who is a total worker health advisor and actually in Oregon, so welcome, Deb. She said that we have a Bring Your Child to Work Day, and it currently does not allow them to bring nieces or nephews or children of friends, but she thinks that they could change this in their workplace.
Thank you, Deb. How about, somebody suggested at my meeting yesterday, what if you had family-friendly Fridays? That would be similar to wearing jeans on Fridays or dress down Fridays, whatever your place of business may call it. Maybe your office is open over the summertime to not just a one-day experience of bringing children to work, but a Friday experience of being more family-friendly. Deb, if you're able to make the change of adding, different categories of who the child is that you bring to work, we would love to help and support you in terms of changing that language. What Boulder County has, and we're happy to share that policy with you, is they have a fully written infants at work policy that's interesting to share, that is accessible for any point or any day of the year, not just one day of the year, but you got to start somewhere. And if Bring Your Child to Work Day is a place to start, we're happy to help and support in any way we can. Thank you for joining us from Oregon too.
Feel free to continue typing in your questions as you have them. And we can answer them along the way. I did want to make another note of some things that we've noticed with businesses that have kind of gone through the pilot stage of taking the assessment before we launched it online. One thing that a lot of workplaces can make is just simply communicating their policies a bit better and making it available through trainings or doing more than just the onboarding. Oftentimes, I know here we have a whole day of orientation, but we may not be in need to utilize any of the benefits or policies that are available to us until a few years down the road, and then we forget what happens because they don't continually communicate the benefits to us or how to work through it. So we had a coworker here who had to figure out her FMLA for when she was going on maternal leave, and that how to deal with everything, and it would have been helpful if she had more training or support from our university and knew where to go rather than just getting it all in a packet of information at the beginning. And that's something that we've seen through all of the businesses that went through our pilot, is that they could definitely spruce up their communication and training, and it's a great way to actually implement certain policies into practice rather than just keeping them on a shelf.
Yeah, that's a really good point. I worked through some talking points for an executive actually earlier this morning, and used some language that we heard from Children's Hospital Colorado that's also on this lovely campus that we're broadcasting from you or to you today from. They did a comprehensive review of every single benefit they had, so 80 or 90 benefits, to assess its family friendliness, and they made a few categories which were sort of easy to address or easy wins. What can they make some really simple changes right now? Some of that is a communication issue. The secondary category was some intermediate next steps that could be done with relatively little harm or effort that could make a big difference. And then they had a third category, which was sort of pie in the sky type ideas, which might be a significantly more robust paid leave program. But it does talk about the spectrum of how to have this conversation. And as Michelle said, whereas you may share some of these resources with folks while they're onboarding, or if they come directly to you, there might be an opportunity to do a better job communicating what benefits you already offer as an employer through an intranet portal, something that you're already sharing with your employees, or through some sort of board, either online or physically, that you have at your place of work, just to remind folks of what supports you already have in place. That's an important tip that oftentimes things get lost in the communication shuffle.
Don't see other questions coming through. Christy said thank you for the childcare ideas. It helped her consider things that she hadn't thought of before.
Sure. We're building relationships with some of these providers on a national level, and so if you want to reach out about, or if you look at some of the organizations that we refer you to and want to have further conversations, we're happy to get you in touch with the right people if you want to take a closer look at emergency child care or dependent care, backup care programs.
Well, David, if people are thinking of final questions, we still have a few minutes that you can type them in. Do you want to highlight anything that's happening throughout the rest of the year on family-friendly work to leave people with?
Sure. There is a lot going on when it comes to family-friendly workplace policies and practices and presentations. Hopefully you'll see the HealthLinks logo or the EPIC logo, or even the Essentials for Childhood, which is out of Colorado's Department of Public Health and Environment. We have lots of presentations going on over the course of the year. Next week, for those of you that are part of the Early Childhood Colorado Partnership, or may have heard of ECCP as an acronym, we'll be doing a live and also streamed, I think, presentation, or the streaming presentation may be a follow-up, about a little bit more about childcare and its relationship to family-friendly workplace policies. So we're doing that next Wednesday on March 8th. We'll be presenting Culture of Health Conference that I know HealthLinks has a big part of, because that's where they award Colorado's healthiest place to work.
At the Governor's Award.
The Governor's Award. So we'll have a breakout presentation there for those of you that are attending Colorado's Culture of Health Conference. We're doing an afternoon breakout session on this topic. Over the summertime, HealthLinks has now announced that, or is planning to announce that its August conference, its annual event, is going to have a family-friendly focus. So I think that's August 17th, you guys have said. And so those are three. We're going to also host a forum. So back up a minute from August 17th, and we're happy to send you this calendar. On June 1st, we're going to host an event at Children's Hospital Colorado, a breakfast. That's the Forum on Family 2.0. We had the last one last year, or the first one last year, and we're going to do a follow-up event to the Children's Hospital Colorado event. So there's all these forums going on, and really the ask is going to be similar to when we follow up with you, is can you, at your place of work or with the colleagues you know, or can you within your network promote people filling out the assessment? So that's really, I think, the ask that we have for you and for all of you that are participating today, is we want to drive as much traffic to that FF Plus assessment as we can. We feel very confident in the fact that it's a brief. It only takes about 5 or 10 minutes for an HR person to complete, and we think that gives a really good snapshot of how family-friendly an organization or an employer is. And we really want to start building up our data and our case studies based on employers that have filled that out to get a baseline of where people are. And then obviously the goal for those of us interested in two-generation supports and public health would be to get businesses that are doing really well, we're calling them early adopters, to get them to be sort of mentors to other businesses that want to learn more, to highlight what these early adopters are doing as far as best practices. And then for those that might be scoring a little bit lower on the totem pole, how can we help them move up the ladder and get a higher certification level or a higher recognition level. So once again, we're hoping that the repository for all of this information is familyfriendlycolorado.com, and we'll be able to build out all sorts of fun things through that website, including a blog or shared resources and all sorts of other places to go. But for right now, that middle button, the FF Plus assessment, is where we really want to drive the most traffic for those of you that have participated and are considering sharing more information with your networks. And we'll probably put the list of events up there. That's probably a good idea too. Maybe either later in this week or early part of next week, I'll put down the events that are coming up with a way for everybody to register on familyfriendlycolorado.com also.
Great.
Yeah.
Well, thank you so much, David, for taking your time to present to us today. Thank you, everybody who joined us on this webinar, to take time out of your day to listen to David present and find out what's going on around family-friendly practices and policies, especially in Colorado. We look forward to connecting with you on the topic throughout the rest of this year. Hopefully we'll see you at some of the events that David just mentioned. Again, if you have any questions specific to this work, David's contact information is on the screen right now. Otherwise, you can contact me, and you can find my information at healthlinkscertified.org. Go visit familyfriendlycolorado.com and look at all of that great information and get access to all of the tools and resources to help you support your employees in all stages of life and help them thrive as well.
Yeah, before we log off, let's end with a Dr. Seuss quote. I have one more for everyone, which I really like, which is, "You're off to great places. Today is your day. Your mountain is waiting, so get on your way." So once again, you're off to great places, and today is your day. Your mountain is waiting, so get on your way. And thanks, everybody. Remember to read with a child. It's an important activity.
And you'll be getting those books. For those of you that logged on today, we'll be mailing them out over the next couple of weeks. So thank you for filling out the extra information on your registration form. And we look forward to working with you soon. Have a great day, everybody.